Mr. Chairman. Mr. Secretary, last year, this committee, as we've said, voted nearly unanimously to pass 2 bipartisan PBM reform bills, which we've already described here, so I will not do that again. Together, these provisions would generate billions in taxpayer savings, in addition to bringing down costs for seniors with chronic conditions. These bipartisan bills reflect by far the most comprehensive and consensus-driven solution to a range of challenges raised by members in both chambers across the political spectrum. That said, this legislation and this issue is absent, as I see it, in the President's budget, sending a troubling signal to the patients and community pharmacies and frontline healthcare providers across the country. Secretary Becerra, what concrete steps does the administration plan to take to support our efforts to get this legislation moved expeditiously and put into law?
Senator, we are absolutely prepared to work with you. I've said this for now over a year, both in this chamber and the other chamber, that we are absolutely ready to work with you on PBM reform. We want to find that there will be more transparency in the way these PBMs operate. And certainly, I think we all agree, there's no reason to have middlemen in the healthcare system if they're not going to provide healthcare. And so we very much look forward to working with you on this, and we appreciate that there's bipartisan support.
Well, I did say in my opening statement that you have given very good technical support as we develop this legislation. I'm asking now that the President step up and use the bully pulpit to get this legislation moved in this Congress. I'd ask you to please take that request back to him. And
you're probably aware, Senator, that we just did an event at the White House on this very issue to really highlight it for the American people.
Good news. When the IRA passed nearly 2 years ago, Mr. Secretary, your department praised the law unconditionally. As implementation proceeds, however, American seniors have experienced the consequences of the law. A growing number of clinical trials for medical breakthroughs have been canceled, particularly for rare disease drugs. Part D plans exclude more and more medications from coverage and subject others to prior authorization and step therapy, delaying critically needed care. Copays continue to skyrocket, often tied to inflated sticker prices, which exclude any rebates or discounts. In short, the system's flaws have gotten worse, not better. Secretary Becerra, can you commit to working with Congress on a bipartisan basis to remedy these issues and improve the Part D program rather than prioritizing IRA expansion, which remains both a partisan and unrealistic endeavor?
Senator, we absolutely look forward to working with you on a bipartisan basis. I will say that the President is very clear and is doubling down on the IRA and making it work even more effectively. But we absolutely look forward to working with you on a bipartisan basis.
Well, it's disappointing, and it has been disappointing to hear, but we received the President's message, and I'm just asking you to help us try to find some bipartisan solutions to move forward. On telehealth. Telehealth coverage has proven critical for seniors and working families across Idaho and the rest of the country. Unfortunately, without additional action, Medicare beneficiaries and Americans with high-deductible health plans risk losing access to telehealth services overnight at the end of this year. Patients and frontline providers currently face profound uncertainty as we move closer to this coverage cliff. Secretary Becerra, what actions does your department and its sub-agencies plan to take in order to avert this unacceptable outcome, as well as to reassure millions of Americans who rely on telehealth for core coverage every day?
Senator, we continue to work with you and your colleagues here and in the House of Representatives on the extensions of some of those flexibilities. As you know, statutorily, we're constrained in being able to extend some of those flexibilities on telehealth. We need your support. We're working also with our state and local partners because, as you know, many of those issues will involve state rules and laws. So, for example, a practitioner practicing out beyond state lines through telehealth, that has to be done with the concurrence of states before a doctor can, in one state, in your state, can practice in my state. So we're working with them as well so we can extend these telehealth flexibilities.
Well, we understand that part of that ball is in our court. It really helps when we have a mutual activity to try to get those kinds of resolutions to the finish line. So thank you for your attention to that. With that, thank you, Mr. Chairman.